This week on Government Matters.
Hundreds of people from the federal government and the private sector come together to seek more efficient ways of operating and to save taxpayers money.
Private companies do it. Can government use shared services to save billions? We have an in-depth report.
But more importantly is what happens in 2015, 2016. Right now, the Pentagon doesn't know. So they're planning at two different levels, one of which is $50 billion a year lower than the other.
The Quadrennial Defense Review. How can officials build a 4-year strategy with no budget and the threat of sequestration?
And the kinds of things that make for a very rewarding career, I think they can compete. Competing on the basis of pure pay, though, is awful tough.
New figures suggest federal IT hiring is up. But is Uncle Sam doing enough? Government Matters starts right now.
From ABC 7 and News Channel 8, this is Government Matters.
Thanks for joining us. Government is the engine that runs this city. That's why Government Matters. Every Sunday we'll bring you the week's top headlines in tech, security, and management. I'm your host, Morris Jones. Topping headlines this Sunday, the Affordable Care Act's Data Hub. In about 2 weeks, new state-run health insurance markets will go live. The Obama administration got a boost this week when California officials said their marketplace, the nation's largest, will start enrolling people as scheduled. On Tuesday, 4 big contractors followed suit. They held a rare appearance before a House committee and projected confidence that they too will be ready to go by October 1st. The health care law is also at the heart of a spending bill stuck in Congress. On Wednesday, House Republicans delayed their vote on a continuing resolution because their Tea Party wing doesn't support it. Here's why. The bill would defund Obamacare, but it would also include language that lets the Senate cut that part out.
And for the sake of our economy, we'll continue to do everything we can to repeal, dismantle, and defund Obamacare.
The legislative session is scheduled to end in a few days. Unless Congress acts, a big part of the federal government will shut down next month, and the U.S. will default on its debt obligations. The Merit Systems Protection Board released an update this week on their progress with more than 32,000 furlough appeals. To recap, 99% of them were filed by civilian employees of the military and the Department of Defense. Now, nearly all of them have been docketed. Some regional offices have started the consolidation process, and others are preparing to adjudicate. Last month, MSPB Chairwoman Susan Grunman told Government Matters her department had to hire temporary staff just to complete the docketing process. The federal government budgets more than $82 billion a year for information technology. According to a new report, a dozen investments at 3 key agencies might be unnecessary. Here's a breakdown. 2 immigration enforcement programs at DHS, 4 programs at DOD. 2 of them track health care for warfighters. 2 more manage dental care. 6 programs at HHS. 4 support enterprise information security. 2 more help determine Medicare coverage. In total, all of these investments accounted for $321 million over a 5-year period. The public and the private sector spent a day brainstorming about how to make the federal government more cost-effective. The American Council for Technology, a government group, and the Industry Advisory Council, a private organization, held a day-long forum on sharing services. Basically, it was a how-to session for avoiding redundancy at federal agencies. Stephen Cheetah reports.
Waste is inevitable in a behemoth like the federal government, but a review of numerous agencies found a staggering degree of duplication, to the tune of billions of dollars. One possible solution, shared services.
At the CIA, we've been looking at shared services for a number of years, and of course getting the actual go to do something is a challenge.
The quest to save some of those wasted billions provided the focus of a one-day forum at the Convention Center in D.C. Representatives from private industries and workers from numerous federal agencies focused on how to share services, essentially having the government agency which is best at performing a task do it for numerous government branches.
The intent here is to really foster collaboration between government and industry around the issue of how do we more effectively adopt shared services within government.
Essentially, what you have is an array of government agencies, all with their own IT departments, HR or financial management agencies. What this conference is looking for is a way for all of these agencies to share the same mechanisms so they can become more efficient and better perform their various missions.
In an era of limited resources and limited budgets, shared services allows agencies to spend their limited dollars on the mission that they are serving the taxpayer with.
The federal government will look to the private sector, in essence, emulating the business model from some major companies with numerous branches. If this model makes a corporation more profitable, it should save the federal government money.
So an example would be in the human resources area. The Office of Personnel Management provides services across the government. And so agencies are talking today about, do we continue doing services ourselves with significant amounts of human resources staff, or do we use OPM, who's expert in that area?
But as with any enormous operation, and the federal government qualifies as extremely large, getting numerous branches on the same page poses a challenge. But by eliminating time spent on work which one agency can handle, various branches of government would spend more time, it is believed by these experts, performing their basic and most important jobs.
Adopting common solutions, really collaborating more across agencies to be more efficient and to allow us to really focus on, as individual agencies, those things that are truly unique to us, as opposed to all worrying about delivering the things that are common to all of us.
In Northwest Washington, Stephen Cheetah for Government Matters.
Now some top names making headlines this week. President Obama has nominated Joanne Rooney of Massachusetts to be Undersecretary of the Navy. If confirmed by the Senate, she would replace Bob Work. He retired this spring. According to Rooney's Defense Department bio, she previously worked as a tax attorney and university president. Rooney joined the Navy in 2011. The president also nominated Beth Colbert to be deputy director of the White House Budget Office. She's a senior partner at McKinsey & Company and oversees the staff development of more than 9,000 employees. Colbert received her bachelor's degree from Princeton and her MBA from Stanford. We'll turn from headlines to tech, straight ahead on Government Matters. In 2010, the federal government and private industry launched a program to move veterans' health records online. Today, it's one of the VA's biggest success stories. The director of the Blue Button program joins me next. In Tech Matters, the Blue Button program. According to the Department of Veterans Affairs, it will help vets enter more health info, access their records faster, and share it with others at the push of a button. Joining me with the details on Government Matters is Teresa Hancock. She's Executive Director of the Blue Button program and Director of My Healthy Vet. Teresa, this is not a brand new system. It was launched in 2010, a partnership between the VA, the Centers for Medicare and Medicaid, the Defense Department, and the private sector. Why was it created and how does it work?
The Blue Button, if you think about it, is an icon in essence, but it allows a patient to really liberate their data. And so patients wanted access to their information, their health information, and VA provides that. We took a survey with veterans and said, you know, what are you interested in? What is it you want from us? And they said, first, I would like to be able to refill my prescriptions online. Second, I'd like to communicate with my providers, and I'd like to have access to my medical record. Well, we're meeting that need. So we listen to the veterans, and this is a means by which we can provide it. It also standardizes the symbol to say patients can have access to their information. And so that's how we collaborated with the Department of Defense and Medicare, and not only them, but also the healthcare industry as a whole. The Department of Energy, the Department of Transportation, the healthcare insurance agencies, and many others, other personal health records are using the Blue Button as a way to standardize patient having access to their information.
That's a great way to explain and liberate their data. In addition to helping vets, does it also save money or improve efficiencies in the delivery of this information?
We actually just did a recent drafts survey, and preliminary, it's too soon to tell because it is still new, but preliminary veteran feedback and satisfaction has shown that. We're continuing to research and look at the information as it's available. The whole purpose of being able to empower the patients and have them take charge of their health is to educate them. And once you educate them, that allows them to be empowered to activate the information that they receive so that they can become better decision makers. And that was the outcome of the survey. Patients said, now that I can see my information, I feel that I've become a better decision maker with my provider and a partnership and collaborator.
The Blue Button also utilizes a concept called Customer Relationship Management, or CRM. FCW describes it like this: the hallmark image of CRM in action is a call center that customers contact to complain, compliment, or inquire. The organization uses data about those calls to not only help customers, but also to inform and refine its broader business operations. Teresa, how does Health eVet and the Blue Button program put customer relationship management to use?
My Health eVet and Blue Button is a means by which we can collect feedback. So we use our help desk or customer relations and take that information and dispel it into what not only the veterans want, but also our stakeholders, our clinical community, because they need to work in partnership. So receiving feedback is so important because that's what drives what we do. That's what we ask for when we request funds. It's what the veteran wants, it's what they need. It's to help our providers have tools to be efficient and effective, and is continually working to provide information and technology in different ways. So think of the Blue Button as well, and the customer feedback as what VA considers the virtual access to their care.
You know, on October 1st, the Obama administration will launch healthcare.gov, a program that will allow millions of people to register for federal and state-run insurance programs. Will it utilize any of the technology you helped to pioneer?
The Blue Button is a foundation that will allow us to move forward with the Department of Health and Human Services, not only to give patients access to the information, but also to have them control it and have it go system to system into the outside external providers that they use. So it is a foundation that also sets up the means by which the Department of Health and Human Services is developing what's called a hub. And so in time, as we work together, all of our agencies, so that we can standardize and continue to collect the feedback from our constituents, is to have a platform that can disseminate the information in a standardized way, have business rules and policies wrapped around it, security and privacy first and foremost, so that our veterans and patients and consumers can all benefit from the wealth of the collaborations and the relationships within each of the agencies and our partners, the healthcare industry as a whole.
Well, it's cutting edge and happening now. Good luck with the project. Teresa Hancock, Executive Director of the VA's Blue Button program. Thank you.
Thank you.
We'll turn from tech to security straight ahead on Government Matters. Every 4 years, the Defense Department completes a full review of military strategy. Their report is called the QDR, Quadrennial Defense Review. But is it a huge waste of time? Our guest has all the answers next. In security matters, the QDR, Quadrennial Defense Review. Every 4 years, the Secretary of Defense is required to undertake a full review of defense strategy, force structure, and budget plans. It's a massive project. This year, there are a few things gumming up the works. How can Chuck Hagel prepare a QDR with no budget and the threat of sequestration? Joining me for some answers on Government Matters is David Berteau, Senior Vice President at the Center for Strategic and International Studies. David, tell us more about the QDR. What's in it?
The QDR, and of course the Pentagon uses a lot of acronyms, so this is another one, the Quadrennial Defense Review. Every 4 years, the Pentagon has to step back and say, what do we really need, how much is it going to take, and when do we need to get it? And really the QDR is designed to take a broad, long-term look, if you will, get out of the day-to-day of both the budget activities and, of course, of operations around the world.
This July, Doug Wilson with the Truman National Security Project argued it's time to ditch the QDR. He told Defense One the Defense Strategic Guidance released in 2012 still works and asks if the QDR is just a waste of time. Is it? Has it ever produced any actionable items?
The QDR actually should be measured in two different ways. Of course, it is a statutory requirement, so by law the Pentagon has to produce one until Congress changes the law every 4 years. But it also does force the Pentagon to step back and take that broader look across the board at future scenarios, not just what's going on today. And actually the law has a competing dynamic here. On the one hand, it says you need to tell us what you need. You, the Pentagon, need to tell Congress what you need, independent of the amount of money you have, but then at the end you have to say, bounce it off against the money and tell us where your shortfalls are. This forces you actually to make priority choices. In that way, it's a very good thing.
Earlier I mentioned the Congressional Budget Battle and the Budget Control Act of 2011, better known as sequestration. What kind of impact will they have on the QDR?
It has a huge impact, and it has an impact today. In 2013, the Pentagon cut $37 billion out last March. Assuming that Congress passes a continuing resolution, that $37 billion will come out again on October 1st, starting for fiscal year 14, and then in January, another $17 billion or so will come out. But more importantly is what happens in 2015, 2016. Right now, the Pentagon doesn't know, so they're planning at two different levels, one of which is $50 billion a year lower than the other. This makes it very hard to do the QDR.
And as you know, there's a heated debate going on within the defense industry. Some call it capability versus capacity. Frank Hoffman wrote about this in a recent op-ed. Here's an excerpt. It's a classical trade-off that pits the readiness of today's force against modernization investments for a better force. It might also be seen as a trade-off between manpower and technology. Now, David, for the casual observer, the U.S. military seems to be at a crossroads. Is it time to invest in capability or capacity?
It's really a choice that you need to have. I come down on both sides, if you will. Capacity, which is essentially the size of your forces, how many troops and soldiers and sailors you have. Capability, meaning the capability of the weapons and the training that they've got. You really have to balance both together. To say it's an either-or choice creates a difficult dilemma that's not real. It's got to be both.
Overall, the defense budget stands to shrink, but there must be some areas of likely growth. What are they?
Well, one of the areas of growth is one that we actually don't want to happen. Not only is the budget shrinking from the top, but inside there's cost growth in some areas that if we don't do something, we'll end up eating up most of the budget without giving either capacity or capability. One of these is in pay and benefits for both military personnel and their dependents and retirees. This has been growing at a rate far faster than inflation for the last decade, but it's very difficult to find the votes to cut this back. The Pentagon keeps proposing modest reductions in the rate of increase, but the Congress won't go along with it.
Thanks for the insight, David Berteau with the Center for Strategic and International Studies. Thanks again. We'll turn from security to management straight ahead on Government Matters. The Partnership for Public Service released a new study this week. It finds hiring is down across federal government, but not in tech. According to our next guest, that's not good enough. We're back in 2 minutes. In Management Matters, the state of the federal IT workforce. A new study published by the Partnership for Public Service finds the federal workforce shrunk last year, and the majority of new hires are in highly professional positions. That's an area where competition is steep. For more, we turn to our guest on Government Matters, Jim Williams, chair of the Industry Advisory Council. He's also Senior Vice President for Global Business Development at Daon. Jim, before we get into the IT figures, let's talk about an alarming statistic contained in this report. The number of new hires by the federal government has dropped by 37% since 2009. Does that surprise you?
It really doesn't. Given the budget crises, sequestration, continuing resolutions, furloughs, pay freezes, I think the agencies are doing everything they can to not have to let employees go and protect their jobs as opposed to trying to hire new ones.
The partnership study also ranks hiring by the Fed's top 10 occupational groups. IT came in at number 5 with new hires at 5.3% in 2012. Is that enough?
That one did surprise me. I saw that medical, in terms of servicing our veterans and others, is number 1, and that makes sense. but putting IT at number 5 when we have enormous challenges where IT impacts all the missions of government. And if you're talking about cybersecurity, big data, mobility, cloud, all of the things that are so important to the government missions, and even the concept of electronic warfare now, that one did surprise me. I think we need more IT workers.
It surprises me. Maybe they're coming down the pipeline as we speak. I know a lot of people in college, secondary, third tier positions going through getting their higher education degrees. At some point, this pipeline is going to be filled with them, but apparently not yet. Now, competition plays a key role in this discussion. You've worked in both the federal government and the private sector. Can Uncle Sam compete for America's top IT talent?
It's not easy. Historically, Uncle Sam competed where they had a mission that was critical to the nation. They also had job stability, and I think the job stability gap has been erased somewhat, but still public service is something I was engaged in for many years. I loved it. I think we have to recruit people based upon that. I do think we can do things with training. I noticed in that report they're hiring more veterans, and I think where we can help people not only get in the door, but help them through their career with training and the kinds of things that make for a very rewarding career, I think they can compete. Competing on the basis of pure pay, though, is awful tough.
All right, so everything you've talked about, what's the solution? Bigger budgets, better recruiting, more federal resources for IT?
Well, I think we do need to look at the pay differences and make sure that we can compete in terms of some degree of minimizing the pay gap. I think we do need to recruit for the federal government. I started in federal government. It was a job. It turned into a passion. I wouldn't trade it for the world. I think we need to tell young people coming out of college how rewarding that can be. Maybe they help them with college debts, help them with training, be the best place to work for veterans, and be the employer of choice.
All good advice. Jim Williams, chair of the Industry Advisory Council. Thanks for being with us.
Thank you.
I'm Morris Jones. Thanks for being with us. Your week is filled with other matters. Safe Sundays for us.